Good morning. My name is Staff Sergeant Martin Schivetta, SCHIAVETTA of the Calgary Police Service Drug Unit. Thank you for being here today, and special thank you to Dr. Mark Urama, Medical Director of PADIS, and our partners at AHS for joining us today. The presence of street drugs in our community is a problem, and it takes partnerships and collaboration with our community members to address these concerns. Today we're here to talk about fentanyl, but let me be clear, whether it be fentanyl, PMMA, cocaine, methamphetamine, there is no such thing as a safe street drug. Fentanyl is a lethal synthetic opiate analgesic, approximately 100 times more toxic than morphine. It is not new to Calgary streets by any means. However, we are seeing an increase in the amount of its availability to buyers. In 2014, there were 36 seizures of fentanyl within Calgary. The largest contained 9,600 pills suspected to be OxyContin, and later identified as fentanyl through laboratory testing. Between January and March 10, 2015, there have been 13 fentanyl seizures within Calgary. The largest incident occurred on February 2, 2015, where a seizure of 11,597 pills were seized. Street-level fentanyl is also known as green beans, green apples, shady 80s, fake oxy, or greenies. This drug can be deadly to anyone who takes it. We are asking members of the public who may have information about the drug being trafficked on Calgary streets to contact the Calgary Police Service drug tip line by either calling 403-428-8100 or emailing drugtips@calgarypolice.ca or calling Crime Stoppers. Myself and Dr. Urama will now be available to answer questions.
Why is it such a popular drug? Is it the price? Is it the availability? What makes it so readily available on Calgary streets?
One thing I think we've seen is the increase in its availability. Obviously, increase in availability may have driven down the price to purchase this drug.
Is this a so-called party drug? Are kids taking it? Are kids buying it?
Well, looking at the deaths and seizures we've had, it extends a broad range age, from teenagers all the way up to people in their mid-40s.
What does it mean for the Calgary Police to bring the warrants to change your way of targeting drug dealers?
Yeah, the individuals who are trafficking fentanyl in the streets of Calgary are certainly a priority for us. We do have active investigations right now in the distribution and trafficking of fentanyl, and we're working with our law enforcement partners across Canada and CBSA to determine how fentanyl is coming into our country and also how it's being converted from a powder form into a pill form that you see before you.
Do you believe it's produced in Calgary? We saw seizures a lot in BC and Saskatchewan.
Yeah. So far, we have not executed any warrants on clandestine labs within the city in regards to fentanyl production. I'd be naive to think that it's not here, and we're doing our best to work with our partners and the public to identify where these possible labs could be.
This is a drug of choice right now, it seems. How do you guys stay on top of all of this? It seems like it's ever shifting. How do you make sure you're staying on top of it and trying to be ahead of it?
Well, I think the message that we need to have people understand is that there is no such thing as a safe street drug. We went through PMMA, methamphetamine, we have cocaine, we have heroin, we have lots of other drugs that can potentially kill people. And that's the message that needs to be out there. There is no such thing as a safe street drug.
Is this more dangerous than some of the others? Or?
Well, it's 100 times more toxic than morphine and 20 times more toxic than oxy. So absolutely, it's very toxic and deadly.
It mimics OxyContin, so can drug users know that taking fentanyl and OxyContin?
I would say that when you're purchasing drugs on the street, you have no idea what actually you're purchasing. There's no quality control.
Can Dr. Urama speak to that maybe a little bit more, the breakdown of, in our newsroom this morning there was a discussion about it being called Oxy 60 and is there fentanyl in that, and what's the breakdown? What are we looking at here? in terms of these drugs, in terms of how deadly these doses are. Maybe if you can just give us some context on that.
Sure. So I want to echo the staff sergeant's comments, first of all, that when you purchase these drugs on the street, you have absolutely no idea what you're getting into. We know that from analysis of some of the PMMA and ecstasy pills from previous fatalities, that the amount of drug can vary from pill to pill. And to put it in perspective, we always think of heroin as the granddaddy of them all in terms of the most potent or most addictive opioids, and fentanyl is at least 15 to 20 times more lethal than heroin. So when somebody takes these pills and they take them unsuspectingly and not knowing that they getting into fentanyl, it's as simple as one pill can kill them. I think to put it in perspective from a superhero analogy, if fentanyl was in a superhero movie, it would be kryptonite. And we all know what happened when Superman got exposed to kryptonite, that even Superman couldn't withstand the effects. So it's naive to think that the average person on the street is going to be immune to the effects of fentanyl.
In the release, we saw that there was also substances, mixtures. You talk about how potent it is on its own, then you mix it with something else. It's a deadly dosage.
Absolutely, and it's. I'm glad that you brought that up, because one of the things that the Office of the Chief Medical Examiner has identified is a drug known as Xylazine, which has been found in at least 6 or 7 of these fatalities, and probably more. They need to go back and do a more targeted search. Xylazine is a veterinary drug. It's actually used to sedate large animals like horses and cattle for invasive procedures, whether it's dental procedures or castrations. It has absolutely no therapeutic use in the human body. It actually used to be used as an agent for blood pressure about 50 or 60 years ago, but it was withdrawn from the market and never studied any further because it caused such a low drop in blood pressure that people were getting sick. The problem is that Xylazine's effects are actually exactly the same as both fentanyl and OxyContin. The pupils get small, the heart rate drops, the blood pressure drops, you stop breathing and you lose consciousness. So even though fentanyl is addictive and toxic on its own, adding Xylazine to that mix simply makes it that much worse.
So is it like an upgraded version of ketamine then?
No, actually, Xylazine is of a similar class of agents as clonidine, which is what's used for alcohol withdrawal. Very mild forms of these types of agents are actually what you find in nasal decongestants and Visine eye drops.
From a medical perspective, what does this signify as this evolves? What does this actually mean to you as we see the prevalence of fentanyl on the street, the easy access to it? What does that actually mean?
Well, what it means to me as a physician, but also as a parent, is that we need to continue the message that the Calgary Police Service has been doing, which is to emphasize that these drugs can affect anybody. They don't discriminate. It is not just a problem of people with addictive potential. This affects everybody. It affects husbands, wives, fathers, sons, mothers, and daughters. And it's important for people to realize that everybody can be affected in exactly the same way. I think the other thing that's important to realize is that, as mentioned, it doesn't just affect addictive personalities. It affects people that are in their teens or in their 20s. These may be people that are holding down jobs. These are people that are going to school, and so it just doesn't discriminate in that fashion. The final thing that's also really important for people to realize is that part of this problem actually lies at the feet of physicians as well, because part of the big issue with this is that Canada is the second largest per capita consumer of opioids, only behind the United States and just ahead of Australia. Now, of course, many of these prescriptions of opioids are legitimate. These are for people with chronic pain, be it from cancer pain or something else of a chronic nature. But it's important to realize from a physician perspective that these pills are addictive. And when you get people addicted on these pills, we do share some of the responsibility to try to stop this.
On the blood research, they've been working a lot on this, and they said they were going to try to make more available one of the drugs that counteracts the effect. Is that something AHA is looking into, like maybe making it easier for people with overdose to have access to that drug?
Sure. So I think what you're referring to is the Antidote Naloxone, which reverses the effects of opioids. So naloxone is an antidote that is carried on all of the ambulances within Alberta, and in particular within Calgary EMS. It's a life-saving antidote that counteracts the effects of fentanyl and other opioids. It helps restore the breathing, it helps restore the heart rate and the blood pressure, and it wakes people up within about 3 to 5 minutes, if not faster. And it lasts for about an hour. So one of the discussions has been about making naloxone more available to communities, as you refer to in the blood reserve. There is currently one program that is already operating out of Edmonton, and there are discussions ongoing with the medical officer of health and with addictions and mental health and the Poison and Drug Information Service about a community-wide naloxone program. Nothing has been decided yet, but it's definitely been discussed.
Martin, maybe another question for you. Maybe
Yeah.
just
Can
let.
you actually just say
Oh.
your name and sort of?
Sir.
Yeah.
Can you just,
Certainly.
identify yourself for a second?
Certainly. Dr. Mark Yarema, YAREMA, Emergency Physician and Medical Director of the Poison and Drug Information Service for Alberta Health Services.
Maybe if you can just let us know why this partnership with AHS is so important in the work you guys are doing.
Sure, and before I do too, if you, the other the information that the doctor provided in regards to fentanyl, Xylazine, is also contained in this one.
Okay.
Sorry.
Yeah, so maybe if you can just let us know why the partnership is important and how it assists in what you're trying to accomplish.
Sure. Drug abuse, drug use is more than a law enforcement problem. It's a community problem, and we need to address this with our partnership and with AHS. AHS obviously is the first responders to medical emergencies, and we need that partnership so we can fully investigate and support the work that AHS is doing. Because as Dr. Yarema alluded to, drugs affect more than the person who's consuming them. It's family members, and we have been overwhelmed by the number of members within our community that have called us and given us information regarding where their loved ones have purchased fentanyl and avenues of investigation for us. So that's very, very important.
Are people seeking this drug, or are they mistaking it for something else?
I think it's both. Yeah.
Does it frustrate you knowing that you're putting all of these investigations together and then trying to put the message out there, but the problem just seems to be getting bigger and bigger and worse?
Well, unfortunately, when you're dealing with drugs, gangs, organized crime go together. They want to maximize profit from illegal activity, and they don't care. I'm talking to the organized crime groups, don't care whether it's fentanyl, PMMA, methamphetamine. They want to make money. So that is frustrating because they don't see the end result that the police and AHS do see.
You keep saying that we see more of these products because it's more available, but why is it more available? Is it cheaper to produce now, or is people demand it more? Like, why?
Obviously, there must be a demand because it is being produced. It is illegally brought into Canada and converted from a powder to a pill form.
Would you consider it an epidemic?
No, and certainly the doctor can speak more about other drug use deaths within our province if necessary.
Like brought in Canada from US, Mexico?
Yeah, most of it comes from China.
Could maybe the
Sure.
doctor's better qualified to answer this. The release says it's not a new drug. How long has it been around? Where did it originate? Is there a pharmaceutical application, or is it 100%, clandestine production or that kind of thing?
Sure. Yeah, really good question. The reason that we say it's not a new drug is because fentanyl actually has a use within modern medicine. It's a very, very effective painkiller. We use it on a daily basis in the emergency departments in the city, be it for treatment of acute fractures or abdominal pain, trauma patients. It's very effective because it works very quickly, and it also doesn't last very long, so it doesn't alter the patient's mental status for a lengthy period of time, which is helpful in the setting when you're evaluating a trauma patient. Of course, what we're talking about today with Calgary Police Service has nothing to do with the medical applications of fentanyl. We're talking about the illicit substance. But part of the reason that we say it's not new is that it's not something that is new to the medical profession. We've been using it for decades.
So is that something that would cause people to buy a larger quantity? You say it's very powerful, but does
It's certainly possible. I mean, as I mentioned, opioids in general are addictive, and we've often referred to as heroin as the one that is the most addictive, and fentanyl is far more toxic than that. So very similar to cocaine and heroin, these agents don't stay around in the body for very long, so you get that immediate high. It goes away after, say, an hour or two, and then you need to continue to have more to be able to achieve that same effect throughout the day. Plus, we know that people develop tolerance to it as well. So similar to somebody who drinks alcohol, you need to be able to take more to achieve the same effect.
Doctor, could you let us know if there's an antidote being made for fentanyl in Calgary? I think Xylazine has a reversing effect to fentanyl. Can you tell us if an antidote is being made available when you can't stop people from taking this drug?
Absolutely. So the antidote that we refer to is naloxone, and that is also not a new drug. It has no abuse potential whatsoever. It actually reverses the effects of opioids, and for people who have chronic opioid use or addiction, a larger dose may actually put them into withdrawal, which is uncomfortable but typically not life-threatening. And the most important thing, of course, is that it's life-saving. Naloxone has already been available on our ambulances, so when an ambulance gets called to somebody with a suspected overdose, our paramedics can go ahead and administer naloxone immediately. The bigger discussion now is whether to have naloxone more available in the community, in the hands of those that are using it, and in the hands of those that might be using it with somebody else, and that's the discussion that's ongoing.
Where is that the discussion at?
At the beginning.